the recommendation is still going to be euthanasia, vaccine or not. It's that we want to stop the process at your pet and not have it jump to people, since it is a disease pets can cause us. We still want to protect pets, but legally, it's really more about the people.
Well, hello, everyone. Rebecca Hardy, Texans for Vaccine president here, and I am honored to be joined today by Dr. Shawn Dr. Shawn Messonnier. And he is a holistic veterinarian. And, while vaccines for people will always be our primary focus, we get a lot of questions around here about vaccines for our furry friends. And so we kind of wanted to unpack all of your most pressing questions with a veterinarian that is actually providing informed consent and patient-centered care for that exact population. So welcome and thank you for joining us today, Dr. Shawn.
Thanks so much. I'm looking forward to it.
Okay, well, great. Well, like I said, but when we were chatting before, I hit that record button. I kind of put out an all call and asked people to chime in on what they would want to ask a vet about pet vaccines. And so I've got a lot to unpack here. And so we're just going to dive right in, if that's okay.
That's great.
Let's just start with some of the basics, okay? And the first question would be, what veterinarian vaccines are recommended and why?
Okay, so traditional vets would have a different answer than I have. For me as a holistic veterinarian, I do believe there's some benefit for puppies and kittens or a new pet to have some limited vaccines, because unlike the situation in people where most of the diseases we vaccinate against are not fatal, in dogs and cats, that's different. So we do want to make sure we have some immunity. So as an example, I had a puppy today, and we did the first distemper hepatitis parvo vaccine. We'll booster that in a month. We'll do one Bordetella, which is a kennel cough or cough shot, and then we'll do a rabies shot. For cats, we do their version of the distemper parvo shot, no Bordetella, and then rabies. So for a traditional vet, if you go to a traditional doctor, he would probably start doing vaccines 6 to 8 weeks of age and do 3, 4, or 5 different series of pretty much everything in the refrigerator. For us, we do about 25 to 30% of what a traditional doctor would do for the puppies and kittens. And for the rest of the pet's life, we do about 10%. We believe that the pet's body should tell us what it needs, whether it's a disease, whether it's nutrition, whether it's a supplement, or whether it's a vaccine. So after the initial visit, we'll do a test called the titer test, which is a blood test, and it lets you know, does the pet have adequate immunity? Kind of what happened during COVID for people that would titer themselves to produce immunity and prove immunity. So in our practice, we do titers every year in place of vaccines, with rabies being every 3 years. And we can talk more about rabies because I know you have some other questions specifically about that. So very minimal shots, something up front, and very little over the life of the pet. We believe that produces better health, less cancer, less autoimmune disease. And my pets tend to live several years longer since I started doing holistic medicine about 20 years ago than a traditional practice would be. And I think that's because we're not putting a lot of drugs, chemicals, vaccines, and bad food in our patients.
Very good. So tell me, what kind of factors should be considered when vaccinating, especially puppies? I mean, I just think about, the people that take their pets to the dog park versus those that don't, those that board their pets and those that don't. What about rural pets versus urban pets? I mean, talk to me a little bit about that kind of individual's lifestyle factors.
Yeah, so all of those go into what we do. Now, like I said, traditionally, I like to have some vaccines in the pet, ideally before they go around other pets, unless they know another pet. So if I have a neighbor who's got a nice, healthy dog or cat, I'm not worried about disease. Yes, my puppy or kitten can interact with that pet if it's safe from a behavior perspective to do so. Dog parks, I personally don't like because I see a lot of injuries from there. Pets are likely to pick up some parasites. And it's kind of like the playground. If the pet parent isn't watching her dog and that dog gets aggressive or hurts another pet, that's where you have problems. I'm not as worried about infectious disease, but I am a little bit because we don't know who's in that park. We don't know what stray animals get in there. So for a dog park situation, or to be walked around the neighborhood where there's the potential to pick up something that might be an infected feces or urine, I'd rather have at least one and preferably two vaccines in that pet, which would push it to about 8 to 12, 16 weeks of age, which is not really that long to wait. You can still take your dog on a walk, staying off the grass, staying more on the sidewalk without fear of anything. And as we know for ourselves, we have to be exposed to bacteria and viruses to build up our own immune system. We just don't want to be exposed to those that have a high fatality rate if we don't have some protection.
Good deal. And then talk to me just about the differences, I guess, in the formulation, or if there are any. I mean, you're informing me. Are there differences in the formulations of pet vaccines versus human vaccines, as far as, the monovalent vaccines or preservative-free vaccines? Like, what are the options that vets have that might differ?
So for us, we have mercury and thimerosal-free vaccines. However, there's not a way to really get a preservative-free one that wouldn't potentially become contaminated. So if you don't put mercury or thimerosal in, you may be putting aluminum or something else. Now, the good news is, because we do so few vaccines, even with those potential, I'm going to use the word contaminant or preservative, we still are exposing the pet to very, very little. But we have to have some way to make medication safe without contaminating them with environmental contaminants. As far as the monovalent, when possible, I try to use vaccines that have the least number of antigens in it. So if we have a monovalent vaccine available, that's great. A lot of vets will have what are called 5-in-1 or 7-in-1 shots, which basically means you have 5, 6, 7 different viral or bacterial antigens in the shot, which is a lot to really do at once. And as in people, we have some research on some of this, but when you start combining things, even in people, we don't really have good research showing, okay, maybe it's okay to give a baby or a child, baby, I wouldn't know if I do that, but a child this, but do they need 20 things at once? And have there been any safety studies showing 20 things is safe, but 30 things isn't? Well, no. So common sense says, look, can we break things up, do the minimal each visit? And again, do what's appropriate. If I have a puppy that's not going to be a hunting dog and not going to be exposed to infected rodent urine, he doesn't need a leptospirosis vaccine. That doesn't make any sense. A hunting dog might benefit from that. So those are conversations we have with our pet parents to decide what's best. We go over the pros and cons, and we help the owner make a decision that's best for the pet and the family.
And what does informed consent look like for these pet owners? I mean, you've already kind of unpacked that quite a bit, but I mean, do you allow your pet owners to say that I understand the risks and benefits and I choose no? Is that?
Yes. So I try to give a lot of flexibility to my clients. I mean, there's some things they can't decline. For example, if we're going to do anesthesia and do surgery, we're going to include medication for pain control. They don't have the option to opt out of something like that. For vaccines, I try to encourage them of the benefit of some limited vaccines at some point, just to get that immunity up. For the rest of the pet's life, we encourage titers. But if someone is really against doing these other things, and we talk about the risk and the benefit, they understand the risk. I try to prepare them from a medical perspective, a financial perspective. We encourage all of our clients to get pet insurance to defray the cost of problems. I think most of our clients, though, it's very rare I find one that won't do any vaccines for especially a younger pet, but most are on board because they don't want to vaccinate their children, or they do very limited vaccines for their families. They're okay with 1 or 2 things, understanding how titers work. And I will say, especially with the work that you've done and other organizations have done, the people that I see are very educated. They understand what a titer is. They understand vaccines, what they like and don't like. So we don't really have a lot of educating to do in our practice when it comes to vaccine.
Wonderful. All right. Well, I'm going to kind of shift now to, well, you know what? Let's go to the page where we talk a little bit more about the rabies vaccine specifically, because I got a lot of questions about rabies. And so the first question is, are the 1 year like some counties require the rabies vaccine every year. Others require it every 3 years. Is it the same dose? Is it the same strength? And why do the laws differ in the different counties? If you can speak to just your suspicion of that.
When I answer this question, I always tell people listening, you're going to be upset with what I say. Not necessarily at me, but maybe at the law or your vet. So there's no difference in what I'm giving, which is a 3-year vaccine, and what another doctor who uses a 1-year vaccine gives. It's the same shot. Legally in the state of Texas, if it says 1 year on the label, you have to give it every year. If it says 3 years, you have to give it every 3 years. So if you get a 1-year rabies shot from your doctor, you're getting a 3-year rabies shot that you have to give every year, and he has to do that because of the law. Now, I haven't kept up with the law to understand why some counties and cities do things differently, other than they have the flexibility to require a 1 or 3-year rabies shot. We do 3 years, and even that we have to admit is over-vaccinating. So the law is I have to give a puppy or a kitten or an adult pet who's never had a rabies shot the initial shot, a booster a year later, and yes, I'm boosting them with the 3-year shot, but that's the way the law is, then every 3 years. Now, we know there's a rabies challenge study that one of my colleagues and mentors, Dr. Jean Dodge, has done, showing at least 2 different brands of rabies shots can produce immunity based on her studies that last at least 5 to 6 years. However, nobody's changing it because of the law. But we know, at least from an immunity perspective, you don't have to give it every 3 years. I do have some clients that ask, can we do a rabies titer? Like I had to do myself. When I was in vet school, I had to get a rabies vaccine for myself, which was fine. And then they would titer you, and as long as your titer was above a certain level, you didn't need another rabies shot. What's stupid about the law is that if you're going to take your pet to Europe, they have to have a rabies titer, and that will be recognized as being adequate. But then why don't we allow that for our pets in Texas? So I do have some clients that like to do titers, and what I tell them is we can do a rabies titer. It's very accurate. As long as you understand the state of Texas will not accept that in place of a rabies shot. So if your pet bites someone or gets loose, or you're trying to register your pet, you cannot use that titer in place of a shot. So I always give clients a choice. Like I said, no one's going to come to my practice. I'm going to take their pet to the back and forcibly give them a rabies shot. Although I had a client today who told me her vet did that, not just for rabies, but every shot in the refrigerator he took back, didn't tell them that they were going to get this shot. They were in there to have their nails trimmed, and they threw a fit and had a $1,000 bill and didn't give permission for any of this stuff. If that happens, I encourage like a lawsuit and writing to the state board, but that's a different issue. So I don't make people do things. I just tell them, here's legally what you need to do. Here's a medical perspective, and you tell me what we're going to do today. And that's how I approach it.
Interesting. Well, I had probably 5 different rabies questions on my list to ask you, and I think you kind of unpacked all of it. It's really frustrating to have these studies that show that sometimes these rabies vaccines can incur or infer, 5 to 10 year immunity. If not, sometimes, one person posted a study that said it can even confer lifetime immunity in some cases. Obviously, it's, pet by pet specific. I know this is a shock to, a lot of big pharma people, but pets and people are individually made up, and we all respond differently to medications, Yeah. But it's just really interesting that if we have these titers that are potentially good for, 10 years, why those are not legally recognized in the state of Texas. Is that a bill we need? Do we need to change that legislatively?
Well, I encourage people to contact our legislatures. I don't know how high on the list of priorities that's going to be for our legislature. And I know they have concerns about rabies, but I also know scientifically, if you're protected against rabies, nothing's 100%, obviously, but giving another rabies shot doesn't make the pet more protected. It's already got a protective titer. We can talk about COVID because it's a similar kind of thing. If you've got natural immunity, COVID being a different virus that mutates, but if you've got some protection, vaccinating on top of protection defies all logic and defies everything I ever learned in school.
Right. Well, as we saw with COVID, a lot of just science kind of left the building, didn't it?
More about, I would get in discussions with people. It's like, COVID is not about science. It's about power, control, and money. If you keep that in mind, you'll understand why nothing makes sense.
Yeah. Oh goodness, we could camp there for a long time. Well, let's move on to a little bit of pet vaccine safety questions. There's quite a few safety questions here. I guess let's just start with like the initial. What are some of the most common vaccine injuries that you've observed in your practice?
Okay, so fortunately, unlike the situation in people, and I've never seen any comparison to percent of pets injured versus children and people injured from vaccines. I believe the incidence is probably higher in people because we have pretty much every child being vaccinated with hundreds of stuff they don't even need on a very short-term, frequent basis. So in pets, from a conventional perspective, I would expect if you go to a conventional doctor, you'll probably see more reactions because your pets are getting vaccinated all the time with stuff. In my practice, I haven't seen a vaccine reaction in years. Now, having said that, I did have a lady who came in today. She talked about, this is the dog I mentioned that had gone in for nail trim. They took the dog to the vet, gave it every shot in the world. That dog had a severe allergic, almost anaphylactic reaction where its face was swelling. It was having trouble breathing. They needed to give it some emergency first aid. So the most common side effects would be relatively benign, which is maybe pain upon injection, usually not. That can be affected by needle size. We tend to use very small needles. You may also have swelling or tenderness or heat or warmth at the injection site. Sometimes a fever, which is not a bad thing because your body's responding, the pet's body's responding to the foreign invader. It produces a fever that helps the immune system. So those things I rarely see, but those are not bad. The more severe ones, like I mentioned, the allergic reaction, the facial swelling, the difficulty breathing, collapsing and going into shock. And then we see some that are not acute like that, but maybe what I would call kind of subacute to becoming chronic. Usually 1 to 3 weeks, 3 to 4 weeks later, where the pet's body might develop an immune reaction where components of the vaccine, either the viral or bacterial particles, maybe the preservative, maybe if it's made with bovine albumin or some of these things that are in there to induce more immunity, the pet's body might mistake its own body or blood cells, like red blood cells or platelets, for the vaccine. So instead of just attacking the vaccine with an immune ramp up, which is good, it starts attacking the pet's body. And those pets come in within a few weeks, often dying because they're literally destroying their own blood cells. That's an emergency. Many of those pets don't make it. In order to make it, you're going to spend $5,000, $10,000, $20,000 in emergency care, getting blood transfusions, chemotherapy to shut down the immune response. That tends to be more common with vaccines like leptospirosis, especially in smaller dogs, or just repeated vaccines, especially on a frequent basis. In cats, and there's been at least one report in dogs that I read, there have been links to cancers, usually with repeated injections, not always vaccines, but usually vaccines, what are called sarcomas, which is a certain kind of subcutaneous under the skin cancer that needs to be treated very aggressively. Sometimes it's curable, sometimes not. I also see that a number of patients who come to me from other doctors with cancer, and they're looking for a more natural or integrative approach for their pet's cancer care. I'll say, okay, your pet has cancer, it's got an immune disease, never, ever, ever vaccinate your pet again. I don't want your pet to come out of remission. And many times people give me this sick look like, oh my gosh, I just took the pet in for a vaccine a month ago. He developed cancer a week later. Why did my doctor not say this? Or my pet had cancer. I had to bring him to my doctor. He was behind on his vaccines, so they gave him vaccines anyway. And it's like, okay, we'll just have to deal with that. But please don't vaccinate pets with autoimmune diseases and cancers. Again, going back to COVID, why are we telling people with cancer, get a COVID shot? I understand people have died of COVID. I understand probably many more have died of these shots. But do you need a vaccine for a cold virus when you're suffering from cancer? It doesn't make sense immunologically. Yes, you're on chemotherapy. Yes, you're more likely to get infected, but we can treat that usually. I can't really take the vaccine out of your body or the pet's body once it's harmed the pet and the cancer is getting worse. And I personally know, my wife and I know probably half a dozen to a dozen people who died not long after the COVID shot, and several of them, their cancers, which had been in remission, came out of remission. Now, again, can I prove as a doctor the shot did that? No. Is there a temporal association? Absolutely. Do they need that shot? No. So again, we have to use common sense with these things. And I know doctors sometimes create fear, but there's rational fear and irrational fear, and that's irrational fear.
Very good. Thank you. Okay, talk to us about liability, because you know how pharmaceutical companies for human vaccines don't have any sort of liability. Is it the same thing for vaccine administrators? Well, I don't know what vaccinators of pets and the companies that manufacture these pet vaccines, are they also exempt from liability, or are the laws different?
Okay, so I don't keep up with the laws as much as I know you and your group do, and I appreciate what y'all doing that because it helps me a lot, save time learning that. So there's not like a vaccine injury compensation fund for pets as there is for people. So if a pet is injured by a vaccine, I will say the very few times I've had issues with that or reactions to medication, the vaccine or medication manufacturers, which are typically the same ones on the human side, they just have an animal branch to them, where they've spun off their animal division. They've been very good about assisting with, and usually totally, the cost of helping. Now, it's often hard to prove something, especially if there's not, I gave the dog a shot, it dropped over dead immediately. Okay, that's pretty easy to prove. Or I gave the cat a shot, whatever. But to prove, 5 years later, your pet got cancer because they got all these shots, well, I intuitively can say that could be a cause. I can't prove that.
Right.
So if there's something that could be a known link or a causal link, there may be exceptions, but so far, for me at least, this hasn't happened often. The companies have been pretty good about it. I will say I hear from a lot of clients who will tell me, their doctors denied that the vaccine could have caused any problems. Well, again, that lacks common sense. We all have different immune systems. I might react totally differently than you or your pet. Obviously, we know vaccines can cause things. And I always, it's kind of like the COVID thing. I keep going back to that because that has totally shown how ridiculous the lack of science was when people will say, well, as far as we know, the COVID shots don't cause this. My response is, well, that's fine, but someone's the first patient to suffer. In my practice, I can't say that all these vaccines cause these injuries, but at some point there's going to be patient number one, patient X. So someone's got to be the first one. Some pets need to be the first one. After 10, 20, 100, with COVID, they still haven't pulled these shots off the market and they have so many complaints. At some point we used to use common sense and say, look, 50 people or pets have been harmed in this short of a time. We need to look at that. With COVID, we stopped using common sense. But again, a lot of doctors still deny that maybe your pet was injured by a vaccine. But I tell people the truth. I'm like, look, I can't promise it was, but in this case, yes, I could say pretty conclusively it was. Or in this case, I can't say it was, so we can't really go there from a lawsuit perspective, because you do have to have some proof if you're going to sue. To make a complaint, probably not. And a lot of companies don't want bad PR. They want their clients to be happy and all of that.
Very good. So what are some of talk to me about the clinical trials for these animal vaccines. Are they more or less comprehensive? We can talk about some of the, we'll just broad stroke it and say pitfalls when it comes to the childhood vaccine clinical trials. Yes. Is that similar with what we're seeing with these pet vaccines? Is it more robust, less robust when we're talking about our furry friends?
I think it's pretty similar. The vaccine manufacturers, and again, I don't keep up with all the laws, but the FDA requires a certain number of patients, human or animal, to be in these trials. And initially, when the vaccine manufacturers are doing this, of course, they're doing it on their laboratory animals to check for things. Then it goes to either across the US or a small area, a regional area, where they will solicit pet owners to enroll in the trials for drugs and vaccines. So, we're never going to have as many patients enrolled in a trial as we'd like, because it could take years to do things. And obviously, from a drug perspective, if there's a drug that could help our patients, we don't want to wait years. Sometimes we're waiting too long for good drugs anyway. So what I would tell people is, when the vaccines come to market, they have gone through whatever the FDA requires for testing. But as we all know, with people and pets, the real side effects show up later when now we're vaccinating millions and millions of patients, not thousands and thousands. then that's when we're like, oh, we need to pull that off the market because this vaccine did this and we didn't know that. Well, okay, we're not going to know that with limited clinical trials that are usually purebred beagles in a laboratory somewhere. As I tell people, you're looking at studies that are done initially, at least, on these laboratory bred animals. I don't treat laboratory bred animals. I treat your pet. And your pet has 101 conditions. You're feeding it differently from these animals. You're doing all of this. Those are ideal conditions that they can control a lot of variables. I can't do that. So we do learn a lot post-marketing for vaccines and drugs. Many times we learn everything's safe. Many times we learn, oh, it's not as safe as we thought.
Very good. And and I'm sorry if some of these questions are very much in the weeds, but one question that comes to mind is, one of the chief complaints that, groups like mine have is that, the vaccines for children are not tested against a true inert placebo.
Right.
Mostly it's just another vaccine that they are, as long as it's no more or less harmful, then it's declared safe. If you're using it, the control is just another vaccine. Is that how they're done with pet vaccines as well, or is it truly inert placebo testing that's being done?
I honestly will tell you, I don't know because I haven't done that much study on it. I would not be surprised if it's similar to the way it is in people. It could be an inert placebo, but as you mentioned, a lot of these companies, they get to control what their placebo is. And when you're doing that, you're obviously set up to get the response you want. So, what I guess I would tell owners is, I haven't done the research on that area, but as in people, we don't really research. For example, I don't know of any research that shows if we give every pet all these vaccines at once, is that the safest protocol? I know in children, they have done research on vaccines, but as far as I know, there's no protocol that's been researched for, is it safe to give 10 shots at once or 20 antigens or 30 antigens? We just do it. It might be safe for that one, but for convenience sake and also saving money, we just do everything at one time. I know the same is true in pets. I can't tell you that doing all these vaccines at once has been researched. I can tell you that every individual has a threshold on how many they could tolerate and still produce a positive and not a negative immune response. I don't know the answer for that. And, we have to also admit, even though we hold the vaccine companies responsible for a lot of things because there's a profit motive, I know one of the arguments, which is true, is that, do moms want to bring their infants to the doctor 50 times a year, or would they rather just come get everything at once and not have to make as many visits back? So yeah, that's true. There's a convenience factor to this. I have to deal with the convenience factor too. If people are driving for an hour to see me, God, I can't keep coming back here. Why can't we do more at one time? Well, maybe we can, but here's the risk. So there's multiple factors involved. I think profit's obviously the overriding factor. And to some convenience, will the moms make the visit frequently for the pet or the child? And in many cases, I know your followers would be like, yeah, we'd love to stretch things out and split out. We don't need all that stuff. But if you're not educated, it's like, well, that kind of does make sense. Let's just do everything while we're here at once. It's like, but no, there's better ways to do that from a logical perspective.
Right. And, I wonder, you alluded earlier about how you've said that your population, your animal population, probably that's, I don't know if it's anecdotal or what, your patients tend to live years longer than, those that see a more traditional veterinarian. Are there any studies that do compare the outcomes of, fully vaccinated to lesser vaccinated animals and such? This is a study that Big Pharma has always refused to do in our children. Is there anything that you'd like to share about that when it comes to animals?
So, I know because I keep up with human medicine as much as I can that there are good studies doing that in people, especially kids with autism and those neurodevelopmental disorders. I don't know of any studies in pets. I was actually talking to a veterinary cancer specialist a few weeks ago, and I think I kind of upset her a little bit. So I was telling her, we don't do a lot of vaccines. She didn't agree that vaccines cause cancer. And again, there's no research of that. And it's like, well, I actually found some research and sent it to her. But I was telling her, my patients tend to live longer. She's like, so are you throwing all these other veterinarians under the bus? It's like, no, I'm just stating a fact. When I was like those other veterinarians, my patients didn't live as long as they are now. And one thing you mentioned that I think is so important to understand, you mentioned, though, that there's anecdotal evidence or anecdotal support for this. A lot of people think of anecdotal evidence as like, it doesn't matter, or it's like there's no value to it. But back in the old days, it only goes back about 100 years when we didn't have studies, even when the drugs were starting to come out, we all learned by sharing what we see in our practice. That's how I learn a lot. That's how I grow. That's how I try things on my pets. And I don't use my patients as guinea pigs, but sometimes there's something new I want to try, and I'll tell the owner, look, your pet hasn't responded to these things yet. Can we try a new herb or a new protocol and see what happens? So anecdotal evidence, and again, we saw this with COVID, is really, really good. You don't have to have a study to prove something. Why do I need to spend money to show hydroxychloroquine works when we knew it worked 10 years ago with SARS-CoV-1? Granted, we're dealing with a different virus, but it's very similar. So if we're doing it in practice and I'm saving a lot of people or pets, or I'm doing this in my practice and my herbs are preventing and treating allergies, I don't need to study something I know has been working for 10 years. If you don't want to believe it, that's fine. You can wait for the studies. I don't have time to wait for studies. I have to help my patients who are sick and dying.
Yep, for sure. What is your advice for a pet owner? This is a very specific question. So, what is your advice for a pet owner whose dog had a severe reaction to the rabies shot, but all of the local vets deny that reactions even exist?
Okay, so the first question I would ask the owner is, if your pet's having reactions to the rabies shot, were they having these reactions either at the time of the visit where the veterinarian would have to see the reaction and say, yes, your pet does have that, or did it happen a short term later and somehow the veterinarian either wasn't notified or denied that it happened? I don't know any veterinarians, if the reaction happened in their office, they could deny that. So that would be kind of a question I would ask. But I guess what I would say is, if you could repeat the question for me again, are the veterinarians denying that rabies reactions happen at all, or just for a specific pet?
Well, in this particular instance, they said that all the local vets are denying that reaction
Even occurs?
Specifically happened to their dog, but that this person's insinuating that the vets have all said vaccine reactions don't happen.
Well, I'll be blunt and say those vets are idiots, but I shouldn't say that. So we're just saying that you're not hearing the truth, because there's good data, even in the conventional veterinary literature, about side effects of vaccines. And I can go into my internal medicine textbooks or vaccine textbooks and read that to a vet. I do know, as I mentioned earlier, that a lot of veterinarians will deny that these vaccines cause cancers or some of these diseases that pop up a few weeks later, because they're not putting the cause and effect to it. I personally have not had any clients who've come to me, other than these longer or later in the disease process vaccine reactions, that would tell me their pet had a reaction to the vet's office and it was denied. I will tell you, those veterinarians tend to say, well, we know your pet had a reaction to the rabies shot, as an example, but your pet still needs it. So what we're going to do next time is pre-medicate them with steroids and antihistamine so they don't have a reaction. That does work, and that is an accepted way to prevent the reaction. But I still come back to, but if your pet's having a reaction, why are we vaccinating it? And unless an authority is telling me I have to vaccinate this pet, in which case I have to load it up with drugs to prevent the reaction, again, I would honestly tell the owner, by law, you have to vaccinate your pet. If the owner said, but my pet will die if I do that, I'll say, I understand that. I'm not going to make you vaccinate. I'm just telling you, by law, you need to. What are we going to do today? And medically, it would be stupid to vaccinate that pet. Legally, I can't make that decision for the owner, because then I can get in trouble by not upholding the law. But the law doesn't require me to steal your dog or cat from you and give it a shot. Even though that happens, it does.
It's so frustrating when that vets feel like, I mean, I'm sure there's pediatricians as well that feel the same way, where, they're being compelled one way by the law and another way by, actually following individualized medicine, which, it's so refreshing to hear you say, medically, it would be dumb to do this, but legally we're supposed to do it. There's just such a contradiction there. It must be really frustrating.
Well, and people need to understand too, with the rabies law, and I almost hate to say this, but the rabies laws are not designed because we care about your pets. They're designed because we care about people. I hate to say this because every pet is valuable to me, but the law doesn't care if Fluffy dies of rabies. The law cares that Fluffy transmitted rabies to everybody in the household who could die, or now we have to do post-exposure prophylaxis. So the rabies laws are not really designed to prevent anything happening from your pet if it's bitten by a wild animal, because the recommendation is still going to be euthanasia, vaccine or not. It's that we want to stop the process at your pet and not have it jump to people, since it is a disease pets can cause us. We still want to protect pets, but legally it's really more about the people.
Very, very important point to make, for sure.
Which is why they're sticklers for the law, really, is what it comes down to.
Yes. Let's pivot to the parvo vaccine.
Okay.
We had a lot of questions come up on the parvo vaccine. So what are your thoughts on that vaccine specifically? This person says that the parvo vaccine tends to come up regularly as having a higher injury rate. So I'd like to know your thoughts on that. And what are the real risks of parvo, and what do you recommend for your clients should they contract it?
Okay, great question. So let's talk about the first one you asked about reactions to the parvo vaccine. Mm-hmm. I question that because most veterinarians don't have that monovalent parvo vaccine. It's combined with a whole bunch of other stuff. So it would be rare for me to see a reaction to just that vaccine, but like any vaccine, it's possible. It's probably combined with distemper, hepatitis, lepto, corona, or a whole bunch of other stuff. So they're probably seeing a generalized vaccine reaction. But regardless, if your pet's reacting to any vaccine or vaccine component, we shouldn't keep using that. As far as what I think of parvo, this is one of those things, I've done a lot of studies about people. And I think you and I may have exchanged emails about a book called Turtles All the Way Down. I think that's what your group recommends. And if you look at it, it really is true that most infectious disease in people started improving before vaccines due to cleanliness and hygiene, because we got people not pooping in the streets and horses pooping in the street. We actually had inside toilets. So a lot of things improved for pets too. However, looking at parvo, this is a disease that's near and dear to my heart, because I remember when I was a teenager, about 17, 18 years of age, parvo was first seen. I was living in Houston at the time, worked for a practice, and we saw at least one pet a day die or be euthanized from parvo. In puppies, they usually had sudden death, basically from a heart attack, like myocarditis. In older pets, it was severe dehydration. At the beginning, we didn't even know what disease they had. Then we discovered parvovirus very quickly, because you can find it with an electron microscope examination of the feces. We didn't have a vaccine. We used a cat parvo vaccine, which worked pretty well, but it wasn't great, but it did stop deaths almost immediately. So I know in the instance of parvo, it's a very, very good vaccine to prevent parvo. As much as, nothing's 100%, but we'll say 99+% effective against preventing parvo, or for preventing parvo. So I'm okay with that vaccine. Again, for puppies or a new pet or a stray pet, I would like to titer first for an older pet, but a puppy that's never had shots, I would do 2 with the distemper vaccine 4 weeks apart, then titer every year. Parvo is one of those diseases like distemper that can produce titers that can last for years. I believe in annual titers because I never know for the individual pet, is your pet parvo vaccine going to last 5 years, 10 years, 3 years, 8 years, 12 years? I don't know. So your pet's body, because we practice individual medicine, can tell me this is what I need today, or this is what I don't need today. So most years we can skip shots. As far as treatment for parvo, I always tell owners, if your pet gets parvo, you better have pet insurance or a ton of money, because you're probably going to end up in the ICU with fluid therapy for a week. Parvo basically kills by destroying the intestinal lining, and then bacteria in the gut translocate or cross the gut lining, get in the body, and these basically have toxic or septic shock, and they're dying. And they need tons of drugs, tons of antibiotics, tons of fluid, antiemetics so they don't keep vomiting, antidiarrheals, pain medicine, because it's very painful to be cramping all the time. And there is a new parvo treatment that I'm sure will be available, if not already soon, at the emergency clinics, that is kind of an antibody against the virus. So it stops the virus from continuing to reproduce in the body. I don't think it's going to be cheap, but I think if it's administered very early, it can shut parvo down from getting worse. The pets still need all the other care I mentioned, but it hopefully wouldn't be as long of a hospitalization or as bad of a disease. So again, if your pet's had any vaccine reactions, Ideally, no more vaccines. If you have to do something, pre-medicating them is fine, but doing the least amount at the time is preferred. And then I think part of it, like I said, because it can be fatal, even with proper treatment, or if you don't have the money to properly treat, it will be fatal because you're going to choose euthanasia. So again, that's one of those diseases, unlike the situation with most childhood diseases, that are more cause morbidity, illness, rather than mortality, death.
Okay. Very good. We're just cruising through these. I was thinking this was gonna be really long here. I mean, we're definitely doing a slightly longer episode here, but I'm just fascinated by everything you're sharing. So let's pivot to a little bit more like legal stuff. So
Okay.
can you tell me? I mean, we've already talked a little bit about how in Texas, titers are not recognized by statute. Is that correct?
For rabies, that's
For
the only shot that's required by law. Now, if you're going to get titers for distemper or parohepatitis, which we do, I'll just go over this real fast. So a titer basically is an antibody measure of how your pet's responded to either disease or a vaccine. Most groomers in my practice area will accept those, as will boarding facilities, as long as they're not associated with a veterinarian's office who's going to require a vaccine. So a standalone boarding and grooming facility, as a rule, knows about titers and will accept those. They will require rabies every year or 3 years. They will require bordetella. Some places require bordetella every 6 months, but even the vaccine manufacturer says no more than once a year. And I think it produces immunity longer than that. So I just do it once and then maybe later down the road. So you have to check with the boarding and grooming facility, but the titers would replace most of the vaccines. Those are not required by law, but they're required because boarding and grooming facilities want to try to let their clients know we're doing what we can to prevent easily transmittable diseases at our facility.
And what about I so appreciate your focus on titers and this, individualized schedule for your furry friends. Is it affordable to do that?
Okay. So that depends where you go. And I'm giving you answers from people that come to my office that tell me pros and cons of what their vets have told them. So for titers, most veterinarians will send them to an outside lab. So you're going to spend $300-400. So that's affordable for some, not affordable for others. In our practice, I never remember the exact cost, but it's in the low $100 plus range because we do our titers in the office for dogs, and we use a less expensive lab for cats. We actually use a state diagnostic lab. So they can be done inexpensively. Because most vets don't do titers regularly, they're going to choose the normal lab they use, which would be $300-400, which discourages a lot of people from doing that.
For sure.
The other thing is if your veterinarian's not used to doing titers, even though they are really easy to interpret, if you've never done it, there's a little bit of a learning curve. What do I do with this information? And I will say to people, titers are not perfect. Vaccines are not perfect. We're trying to get as much information inexpensively as we can to make a good recommendation. Again, I go back to COVID. No, not too detailed on the medicine, but we have B cells, which are producing the titers, and T cells, which are a different form of white blood cell that are the memory cells. So even if you don't have a titer, but you've had the disease or the vaccine, it is possible you can still respond and fight off the disease. The problem I have is I can't easily and cheaply measure T cell function. So I have to say if the titer is very low or non-existent, I feel good about doing another shot, another vaccine. But if you say it's 100% necessary, I can't measure an answer and give you that. So because we do so few vaccines over the life of the pet, if the titer is low, and assuming your pet's at a high risk of disease, doesn't have cancer or immune disease or chronic other diseases I treat all the time, like allergies and epilepsy and things like that, maybe isn't 18 years old and is probably never going to be around another pet and it's short, whatever's got left in life. Those are decisions we make together with the owner and myself. So I can give kind of generic information, but it really comes down to what is the risk for your pet, knowing the age, the breed, incidence of disease, lifestyle, and you have to take that into consideration. It's kind of like, I know y'all are probably against the HPV vaccine for kids for cervical, not even cancer, but for papillomavirus. Again, if someone wants to do that shot, I think you need to look at risk and reward. What's the risk? What's your behavior? What's your lifestyle? If the vaccine is going to potentially offer some benefit, whether we're talking people or pets.
Very good. And this is a kind of an interesting question. Can pet owners be held legally liable for a potential disease transmission? Have you heard of any cases like that?
The only way I would think that could happen is if they know their pet has a disease and still exposes other pets to it. So if I knew that my dog or cat had parvovirus, well, first of all, I shouldn't be exposing them because they're probably sick in ICU. But assuming they weren't that sick yet and I knew they had a disease, I'm exposing other animals. Technically, yes, another owner could sue me if they could prove that I'm exposing them intentionally. But you have to understand too, pets are still considered property. So you're not going to get a lot of claims other than maybe, if the pet infected another pet, what were the medical costs of that? And that's kind of what you could maybe sue for or claim for.
Very good. Okay, I'm going to bring one special guest onto the screen right quick as we wrap up. 1 second.
Okay.
And this is...
That's your little Havanese.
This is my little Havanese Ranger.
Hello, Ranger.
Hello. Anyway, we just love him here. So as we're wrapping up, I just wanted to ask you, are there any policy or legislative changes that you would propose and like to see when it comes to veterinary medicine in Texas?
Obviously, we talked about the rabies shots. I'd love it if they would accept titers in place of rabies vaccines. I'd love to see that. Otherwise, I guess all veterinarians would love our state board to function better, just like the medical boards need to function better. But I don't know really anything legislative, because for the most part, I don't really have to deal with a lot of legal issues in my practice. I think rabies is this thing that comes up the most because people really don't want to give rabies shots every 1 or 3 years. So if we could change that, that would be ideal. I think that's pretty much about it. I don't really see a lot of other things that cause me any concerns. Have you seen anything or heard from any of your members that they would love to see better about veterinary visits or from a legal perspective?
Most of it would circle around being able to, for lack of a better word, just get around these vaccination requirements. And because to your point, not every animal needs a vaccine for everything, or even particularly for rabies every year or even 3 per se. And so, perhaps having Texas, my understanding is that there's about 16 other states that do allow for either rabies titers or exemptions. And so that would probably be what I would
agree. I think that, the people watching our show need to understand too, that rabies is the only vaccine that's required by law. Everything else we have is either required by me, because I'm a veterinarian, I want that done if you're going to bring your pet in my practice, or a groomer, or a boarding facility, or doggy daycare. Medically, I'm very concerned about parvo and distemper, so I think that's a good thing. But just giving every pet a vaccine because it's in the refrigerator and I can make money, but it's not of any use to help your pet based upon your health, your pet's lifestyle, just doesn't make sense. And again, hopefully you can have a non-argumentative visit with your veterinarian, or start calling other vets and say, hey, would you accept titers? What do you require here? I always like people, if they're going to come visit us or learn about our practice, you can go online and learn about us. It's pawsandclawsanimalhospital.com. But I want you to be comfortable with what we're suggesting for your pet and why, and know that we're trying to work together to maximize the health for everybody.
Well, I just so appreciate this kind of personalized care that you provide your clients, Dr. Shawn. It almost seems, and maybe this is specific to you, but in general, I think that when it comes to vets, there's a little bit more awareness of that individualized medicine, the safety concerns, and even the personalization of the schedule there's a little bit more awareness and flexibility. Not across the board, but in general, more so than it comes with the people. And it's just always so interesting when we think about, a Chihuahua needing the same, getting the same vaccine as a Great Dane. And I think about that too, when we think about like the 5-pound baby getting the same hepatitis B vaccine as the, 400-pound
Right.
linebacker or whatever, like there's got to be some movement of that individualized component.
Well, and I will say this too. If clients are concerned about, can we give my pet a little lower dose? My answer is always yes, because we're going to come back and do a titer to see if that lower dose was effective. And really it is, because we put so much antigen in vaccines because there's this huge weight range that we know lower dose vaccines can be as effective as the quote unquote normal dose vaccine. The only thing I would say kind of in closing too is, I don't want to be too hard on doctors, although a lot of doctors are probably harder on their clients than they should be. But there are legal liabilities for me. So if I do a low dose parvo vaccine and your dog gets parvo, I can't legally say, well, I've got all this research that says low dose parvo vaccines are fine, when you want to take me to court because I didn't do the right thing and give your pet who's like your little dog Ranger 10 pounds, I didn't give him the 150-pound Great Dane dose. So if people want to work with us on that, just understand we have to do some follow-up so I can at least legally say, look, I don't want to get sued. I'm trying to help you. We have to work together on that. Sometimes that working together produces an extra expense, but that's the way life is sometimes.
Yep. And I would say that your pet's health is worth a little bit of extra conversation and expense. Yep. I always say pay now or pay later, right?
Wow. Pay a lot later. Yes.
Yes. Well, Dr. Shawn, I think that kind of wraps up most of these questions. This was a meaty episode. So I just so appreciate your insights here. And if we get feedback and more follow-up questions, we'll just have to have you back for round 2.
That sounds good. Thanks for all the work y'all are doing. I really appreciate that so we don't get all forced to do these shots that aren't necessary, especially our kids.
You are so welcome. And I am just so thrilled that you joined us today.
Thank you for listening to the Shot Callers podcast. Please, if you found value in this content, rate us and share the podcast with a friend. It's a great way to get the message out and to empower everyone to make informed decisions. Until next time, never forget, we are the Shot Callers.